Hi guys, and welcome back to the channel. So this is Every Bodybuilder Needs to Know This Part 2. I think I'll create a series out of it because there are important things that I think every, if not most bodybuilders, especially those using steroids, should know. So I'm Dr. Downey, and let's discuss Tachycardia Induced Cardiomyopathy. So let's break that down. It does sound a bit complicated. However, tachycardia just means like high heart rate, usually anything above 100 beats per minute, but it's also individual dependent based off of your baseline. So for someone who is unfit and overweight, their usual heart rate is probably around 80 to 90 beats per minute, and therefore tachycardia would be much higher for them. But for someone who's fit, if their resting heart rate is around 50, anything above 80 could be considered tachycardia for them. And so then there's this tachycardia-induced cardiomyopathy. So cardiomyopathy just encompasses any disease of the heart muscle, which there are many types of causes. So this is the one caused by a high heart rate, and as we've discussed, there are things like high blood pressure, which is hypertensive cardiomyopathy. So cardiomyopathy is usually just an enlargement or disease of the muscle of the heart. So as we know this because it's mentioned a lot by now, steroids do cause cardiomyopathies, and this tends to be through a variety of mechanisms. And I'd say blood pressure being one of the biggest ones. However, there's also androgen receptor induced cardiomyopathy and things like that. So today we'll discuss the tachycardia induced cardiomyopathy, or just TIC. The good thing to know about this is it's completely reversible on treating the tachycardia, so lowering the heart rate. And the most common causes are things like atrial fibrillation, atrial flutter, SVT, so supraventricular tachycardias, PVTs, and ventricular tachycardia. So those are the causes. So which of these groups would a steroid user fall into? Well, most steroid users would probably have a ventricular tachycardia, and the reason for this being is that steroids have sympathetic nervous system activity. So the sympathetic nervous system, you have the parasympathetic and sympathetic. Parasympathetic is when you're chilled, calm, relaxing, eating, digesting food. And sympathetic is that fight or flight response, so where you're in overdrive. And so steroids seem to stimulate this, and that's why some people might report getting more anxious while using steroids. And not surprisingly, the way this is mediated is through activation of the renin-angiotensin-aldosterone pathway, which we've discussed a lot in detail, especially in the other video I made about heart enlargement on steroids. So the renin-angiotensin system, which is increased by steroids, or stimulated by steroid, seem to indirectly increase the heart rate. And again, this means there's a place for ARBs, but I'll get on to that. Angiotensin receptor blockers, but I'll mention that later. So different steroids have different potencies on this, so it's good to know which is more, and it's individual dependent. You may find that certain steroids increase your heart rate more than others. But again, in a non-steroid related, it is steroid related because steroid users use them. Things like fat burners and stimulants might have an effect, and this is more through just stimulating the sympathetic nervous system to burn fat. That's the whole point. So reducing your heart rate in this case might not be beneficial for that in terms of fat loss, but I'll get on to what you should do in that case. So, so my suggestions, so there is no definite way of treating these TICs. However, obviously, first course of action would be to stop the offending agent, as always. So the steroid, the fat burner, whatever it could be. And then if that isn't possible because you depend on these steroids for this effect or that effect, I'm not judging, then we'll move on to the second step, which should be a staple in everyone's, even non-steroid users, fitness routine, and that's cardio, at least 150 minutes a week, because this helps, well, helps with the heart, its ability, its left ventricular ejection fraction, which obviously could result indirectly in a decreased heart rate and a more healthy heart. It also decreases blood viscosity, which might also increase your heart rate if not kept. And then after you've done cardio, let's move on to this section, and this splits into two parts. It's the fat burner versus the anabolic steroids. So if it's an anabolic steroid-induced tachycardia, the first line would be to introduce an ACE inhibitor or an ARB. And we've discussed this before because it interferes with the renin-angiotensin-aldosterone pathway, which seems to stimulate the nervous system and therefore causes the increased heart rate. And these medications decrease angiotensin and agents like that. However, if it does not correct on addition to these agents, you would have to move on to the next step, which are beta blockers. Now, these are known to block beta receptors, and you have some in your heart, and if those are blocked, then your heart rate decreases. And some may say, well, it would make sense that if you block your beta receptors and your heart rate is lower, this could hinder your performance in the gym. That is possible. However, there are more selective agents, such as nebivolol, which might not impact performance, especially in athletes, as much as others, non-selective agents such as propanolol or Indoblock or Inderol. And nebivolol might have benefits such as stimulating beta-3 receptors or being an agonist to beta-3 receptors, which I'll mention in another video. So if this still doesn't work and you've added the beta blocker and the ARB, what should you do next? I would highly recommend discontinuing the agent. See if, on discontinuation, seeing if your heart rate corrects. If it still doesn't correct, then there could be a different cause. There could be something you're unaware of, such as an overactive sinus node or something like that, a sinoatrial node or something like that. It's just good to rule out. Also, just as another measure, you should control your blood pressure, because blood pressure and heart rate are quite closely linked. So if your blood pressure is not controlled, then your heart rate might be elevated also. But that's the ARB and stuff should help with the blood pressure. So then the second part are fat burners, and well, that's actually the point of a fat burner, to stimulate your heart rate and increase your body's metabolism, and that's how it causes this fat loss. And the addition of something like a beta blocker might cancel this effect out, although that is individual dependent. Personally, I don't think fat burners should be used in any person that is not competing, since a diet should be sufficient in causing you to lose weight. However, if you're trying to diet down to low body fat percentages, such as let's say 5%, and you would be unable to do that just through diet alone, then I would perhaps not consider discontinuing the agent and just continuing it up until you reach that point, and taking measures such as cardio and controlling your blood pressure until then, or possibly swapping to a non-stimulant based fat burner. So I hope you enjoyed this video and that you learned something about tachycardia induced cardiomyopathy. So in summary, steroids do cause tachycardia, which could induce this heart enlargement or cardiomyopathy, and I would recommend that you use an ARB or an ACE inhibitor as a first line, and then beta blockers. If you're using a fat burner, I would consider discontinuing it if you're not planning on competing, or swapping to a non-stimulant based fat burner. Thank you again for watching, and I'll see you in the next video.